Hello, everybody. Welcome back to another episode of Hybrid Healing Hour. Today, we are going to talk about leaky gut syndrome, and we have a very, very special guest with us today, Elyse Marrone. Hi, and please introduce yourself to everybody.
Hi, how are you? Thanks for having me. So my name is Elyse Marrone. I'm a dietitian. I'm trained functionally and integratively through the American Academy of Anti-Aging Medicine, as well as the Institute for Functional Medicine. So a little bit different than your typical dietitian. I'm part of the practice group Dietitians in Functional Medicine. So we do look at the body and at food as medicine, and a little bit different than just calories in, calories out, and macronutrients.
That is exactly why we love working with you.
And we have been working with you for quite some time, and we learned so much from you, and we're excited to share some of your information with our listeners. So let's jump right into it. So leaky gut syndrome, also known as intestinal permeability, was once ridiculed by the medical community. For the longest time, it was dismissed as doesn't exist, and there's no proof. And now pharmaceutical companies are actually racing to develop treatments for this. So things have turned around. And, where do the average American get their medical information? From Wikipedia. If you look at the Wikipedia page on leaky gut syndrome, it says it's a hypothetical, medically unrecognized condition, followed by 3 short paragraphs that completely dismiss it. And then if you look at the Wikipedia entry on Bigfoot, it's 10 times longer, right? And so this is something we see in our practice on a daily basis. And I know you see a lot of patients with leaky gut syndrome. So let's start talking about it.
Okay.
So we know the gut is also known as the second brain, and it's because there's so many chemicals that the gut uses to digest the foods, and the same as the brain, and it will relay the message back to the brain when the gut has something going on that's not quite right. So we know there's thousands of different bacteria in the gut, and it's not just bacteria. There's everything. There's fungi, there's viruses, and there's good and there's bad, right? So we know there's a cross-regulation. So why don't you go ahead and tell us a little bit about what happens when there is leaky gut syndrome? Like, what is that?
Yeah. Okay. So first of all, if your gut was perfect, which nobody's is, but if it was, it would have enough permeability, or I guess leakiness, but not a lot of leakiness, just enough to let through the small molecules that we need to have health and energy. So when you break down fats, you would have fatty acids. The fatty acids could fit through, but the whole fat would not. Proteins are going to be broken down into amino acids, and those could fit through because they would just be small enough. Vitamins, minerals, and simple sugars. So that would be a healthy, perfect gut. The gut lining is actually only 1 cell thick. So it's very susceptible to inflammation and things that can cause it to increase the permeability of the gut. So if you think of it like a cheesecloth, it's only going to let through the liquid, but as we do damage to it by things like alcohol, and there's pesticides in our food that can cause that. Taking certain medications, especially antibiotics, can cause an increase in gut permeability or leaky gut. Gluten, especially, we now know that doesn't matter whether you're celiac or gluten sensitive or, quote, normal. Every time you eat gluten, which is the protein that you find in barley, wheat, and rye, you'll see an increase in gut permeability for a little bit of time.
When you say increase in gut permeability, are you saying like the size of those holes, those quote unquote like microscopic holes, get bigger?
Yes,
okay.
That's exactly it. And that's what leaky gut is.
So it allows bigger molecules to penetrate, which is not always a good thing.
Well, it's definitely not a good thing because if you think about it, that is 70% of our immune system is in our gut lining, and the mucoid-associated lymphoid tissue, which lines the gut. The intestines. So now we're showing this immune system things that it doesn't know what to do with. It shouldn't be seeing, like a whole protein.
And so along with those lines, the bacteria and the good and the bad line that 1 cell barrier, right? Mm-hmm. And so that is giving us that barrier protection. And so when we get this leaky gut syndrome, it could be due to many different things, like you said, our exposures, our toxins, but also even you could have overgrowth of the bacteria as well, right?
Yeah. So, your gut lining does have a like mucus coating to it, and that helps protect it from like stomach acid and things like that. And then there are thousands of different species of bacteria and, billions and billions of them. So we have 2 to 4 pounds of bacteria that are from our mouth to our anus that live within us. And if you looked at the number of cells, I think they said there's more of those foreign bacterial cells than there are of our own human cells. So the balance is what's really important, because we all have things in our gut that could potentially be pathogenic, like E. coli and C. difficile and Candida. They're normal flora. They're potential pathogenic, but they're normal. When the amount of probiotic or good bacteria is less than about 20%, that's when we start seeing the dysbiosis, or the overgrowth of the bad bacteria. And so then we'll start to see symptoms related to that. And if you think about these bacteria, they're living organisms, and what we benefit from them really is their metabolism. It's either they're helping us to break down things that we don't break down and extract nutrients from it. They poop out things that can feed the other good bacteria, but also that can act as messengers to reduce inflammation. So that's why it's so important that we have the right amount and the right kind of bacteria in our gut. But it's hard for us, especially because our environment is so toxic. So we kill these guys off every single day. You drink water, it's fluorinated and it has some chlorine in it. It just does. That's going to kill off some of that microbiota. Stress will kill it off. A lot of the medications that we have patients on that they take forever and ever, like the PPIs, which break down, lower acid, that will cause an overgrowth of the bad bacteria, and therefore it crowds out the probiotic or the good bacteria. They compete for real estate in food, right? So there's only so much room. There's a lot of room actually on our gut lining, right? It's like 4,000 feet or something, size of 10 tennis courts.
Right.
Yeah. So there's a lot of space, but if we have 85% that is being overtaken by this potential pathogenic bacteria, then the health outcome of that is going to be felt. And, that's when we start to see symptoms.
And when you say pathogenic, that means harmful. Like, we have them living there, but it's like they can just switch when it's too many.
Yeah. And the good guys keep them in check. So
Right.
there's like a constant,
Like you said, homeostasis, like a balance.
Right. There's a balance between the two. So that's why we, as like one of the core supplements that we give to patients, a probiotic is going to be key. It's so important for, it helps to balance the immune system. It can help the, with body composition, because it helps with extracting calories and then utilizing them versus storing them. It's good for the brain because what they poop out can act as neurotransmitters. And we know that 90% of serotonin is actually made in the gut, not in the brain.
Right.
So we want to support the gut because it's really important, not just for physical health, but for mental health. And they're connected.
As you said, 70% of our immune system and immune function comes from the gut. Mm-hmm. And so we do know when you can, some other causes of gut dysbiosis or throwing off your homeostasis is chronic infection or infectious disease. I mean, even Lyme disease, mono, COVID. We saw it a lot with COVID. People all of a sudden had signs and symptoms of leaky gut syndrome.
And the vaccine.
And we as a medical community, we throw around antibiotics like they're nothing, right? Like they don't do any harm. And it's so difficult to convince people now you don't need an antibiotic for this. That you're going to do more harm than good. And who hasn't really been on an antibiotic at some point in their life? And every time you are, you're wiping out huge colonies of good bacteria.
Exactly. And any time an antibiotic is prescribed, a probiotic should be also prescribed to be taken 2 hours after each dose, because the antibiotic will kill off all bacteria, not just the infection that we're trying to target. Usually they're more broad spectrum and they will kill off everything. So you want to replace the good bacteria. And if you think about the the risks of antibiotics, a lot of times you'll see that's when people start with something that ends up going on and on and on for years and years. And it could be a mental thing, like all of a sudden they have anxiety where they never had anxiety before, and it was after taking an antibiotic. So we really want to make sure that we're protecting. I mean, that microflora in our gut lining, that's like an important organ for us. So we have to really start thinking about it like this is an organ and it needs to be protected, just like we protect our liver and kidneys and thyroid,
Right. And then some other causes of the dysbiosis, like you mentioned, I mean, we're everyday toxins we're exposed to, but people don't realize what they put in their mouth as food. All those emulsifiers that is in the food to, thicken or to keep them from separating, like guar gum or carrageenans, and they're just terrible for you. So it's very important to read the ingredients on the list.
Yeah, I'm really more concerned with the artificial colors and the artificial sweeteners, which we know cause leaky gut. And, everybody thinks, oh, I can have a diet soda. That's great, because it's no calories. But actually, those chemicals do actually stimulate insulin response because the brain says, oh, there's food coming. So that can actually cause people to gain weight. And they think it's nothing. But it also will help, will hurt the bacteria in your gut lining because it will kill it off.
Exactly. So here they were formulated to initially help prevent metabolic syndrome, and in reality, they're causing it. And people do not realize that.
I think it's Splenda that was actually initially, they formulated it as a pesticide.
Wow.
Because it causes the intestines, when the insect eats it, it causes the intestines to explode. And then they found out, wow, the reason they're attracted to it is because it's sweet. So then they're like, oh, okay, let's put that into our diet sodas and diet foods.
Right.
And granted, we're a lot bigger than an insect, but if you're taking this every single day over and over again, it's going to be a problem over time.
Well, and that's why people don't realize that, like, you can still lose a lot of weight if you just cut out soda in general. It does not matter. It doesn't matter if it's diet or regular.
Exactly.
I mean, you're contaminating your body. So are you okay with any artificial sweeteners such as like stevia or truvia?
So stevia is not actually artificial. It's actually a plant leaf, and I'm fine with stevia. It actually has some antimicrobial benefit to it as well. In moderation, because again, it's still going to stimulate the body to make insulin. And if you have blood sugar dysregulation, which probably many people do, and many people don't even know that they do, that's not going to be an ideal setting for your metabolism. But if you're going to do any kind of an artificial, or it's not artificial, but like a natural non-caloric sweetener, stevia is fine. Monk fruit or lohan is another one I like. So you can use that. That's a little less bitter. It actually tastes more similar to sugar than stevia. Stevia to me has a bitter aftertaste, and it kind of tastes a little bit like saccharin. Mm-hmm. But it's not unhealthy, but too much of anything can kill you, right? Even water or air. So,
and you also have to check the other ingredients with these sweeteners, like monk fruit. They usually add sugar alcohols to them to just fill it out a little bit more.
Yeah, and that can be, for some people, they can't tolerate that at all. So for sure, you want to look and make sure that, I like to say, if you can get it organic and it's all by itself, that's the best way to do it.
And then I also was learning more and more. Every day we're learning that genetics can also be a cause of, or contributing factor to, your gut dysbiosis. And we'll get into some testings that we can do later, but how your genetics can play a role in how your body detoxifies or methylates. Mm-hmm. And I knew about the methylation, but I didn't realize how it affects the gut, So I thought that was very interesting.
Yeah.
So why don't we go ahead and talk about signs and symptoms? I'm sure you can take the lead on this. Tell us what your patients come in complaining of.
Yeah, so the majority are going to start complaining, and what gets them to my office is they've been everywhere else, right? So they've seen their GI doctor, and their GI doctor scoped them and said, well, you don't have anything, you're fine. This, maybe you have IBS, which is just a junk diagnosis because it's just symptoms, but they don't know why. So that's what we do in the integrated space is we say, okay, well, why? Why are you having reflux? And usually they say, well, I'm having heartburn because I'm making too much acid. But we know in our research that it's actually most likely that they're making too little acid. And that's what causes the esophageal sphincter to tighten and close. So without enough acid, your esophageal sphincter doesn't have any reason to close. It gets floppy or lazy. And now, even though you're making a very little bit of acid, because stress decreases how much acid you make, that acid can flow upward where it shouldn't have the access to it and hit the esophagus. So that's definitely one of the things that I think you're going to see with a leaky gut patient. They tend to have a lot of food sensitivities because the whole protein of the food is being shown to the immune system. And then the immune system is making antibodies. So now your immune system is very busy fighting your food. Now what happens if you actually have a problem? You get COVID, you have some kind of viral or, bacterial infection. Well, your immune system is very busy, and so it may not be able to address that as efficiently as if you didn't have leaky gut. Gas, bloating, stomach pain, distension, constipation, diarrhea, all the fun stuff. That's what you're going to see. So leaky gut, IBS, they kind of fall into the same bucket, I think. So you could say leaky gut causes the symptoms of IBS.
And then it's not always just gastrointestinal symptoms, right?
Absolutely not. Again, like you said, right when we started, the gut and the brain are connected. So that's why they call the gut the second brain. So many times, especially like when I see a patient who comes in and they have an overgrowth of candida, which is actually a yeast that's normal in our gut, but when it overgrows and there's too much of it, you're going to see that patient pretty much 100% of the time will have sugar cravings, will have brain fog, and a lot of memory, have a hard time remembering things. It could look like a sleep issue where they can't fall asleep or they can't stay asleep. And it's all due to dysbiosis. But who's really putting those two together, right? They're saying, oh, you can't sleep. Let's just give you some Ambien.
Right. It's terrible.
That's not helping the gut. That's not helping the microbiota at all.
Exactly.
So now we're just making it worse, but we're putting a Band-Aid on it and we're saying, okay, well, at least you're sleeping.
And then when they have a side effect from the Ambien, they'll give them another pill for that.
Yep.
So some of the things that we see in our practice with leaky gut are things like headaches. You said chronic fatigue, but arthritis and joint pain, changes in their menstrual cycle. Leaky gut can imitate hormonal imbalance.
Absolutely.
And not to say that they don't have a hormonal imbalance also, but you're not going to fix that unless you fix both problems. Edema, fluid retention, palpitations, anxiety, depression, obesity, and skin problems, right?
Yeah, I think skin, I see a lot of younger patients and as well, and skin is the number one complaint. I mean, even what I have found very interesting is psoriasis and eczema flares. And when I talk about gut, they're like, I'll just go to my dermatologist. I'm like, oh, you're just going to get another cream or possibly even a systemic steroid, and that's going to ruin the gut even more.
Yeah, and those are autoimmune diseases. So they don't really, we're like if you think about it, we're made like a donut. The skin on the inside of our body is very similar to that of our outside skin. So you'll see a lot of things that will affect the skin, but really they start in the gut. So
yeah, and acne, I think I've definitely been able to clear up acne naturally with just changing diet alone and clearing up the gut.
Yeah, absolutely.
So, and that's much better than going on the toxic medications that they give. Accutane.
That's
oh my
worst.
gosh, terrible. Yeah. And or antibiotics. They give you every day. Take an antibiotic. Oh, for the rest of your life.
And even if you're putting it on your skin, it's still getting absorbed systemically, and it's going to kill off the good bacteria. Exactly. And there's good bacteria that lives on your skin too, so you don't want to kill it.
That protects you. Right. Exactly.
Yep.
So obviously there's a lot of different conditions that are associated with gut dysbiosis or leaky gut. And you mentioned, IBS is a big one, but obesity, diabetes, metabolic syndrome, and let alone psychological conditions, autism, Alzheimer's, ADD. And as you mentioned before, you can fix some of these conditions by cleaning up the gut, but also avoiding like food dyes. People don't realize that there are food dyes in so many different things you put in your body, like foods and drinks.
Exactly.
There's caramel color in soda. Why do you need that?
The link between autism and leaky gut is so controversial, and it's criticized because there's no hard data. But what's the harm in putting someone on a diet and trying? It's free. It's not costing you anything, and it's a healthy diet. It's not like we're telling you to take something crazy. And I would think that most people would want to try that first before medications and other things.
Yeah, I mean, especially you see these kids with ADD, right? They all have ADD. Everybody's on Ritalin now and Adderall, but a lot of times it's really related to food sensitivities, and that can be due to leaky gut. So let's fix the gut. Everything in our world, and really if you look at the biochemistry of the body, pretty much everything starts in the gut.
Absolutely. Everything is inflammation, and inflammation starts in the gut.
Yep.
We agree.
So how do we check the gut? Why don't you tell us some ways to look at this, and how can we diagnose this?
So in my practice, I start with a symptoms profile where I'm really just looking to see what they're complaining about, because that saves me a lot of time if they have put that down for me, and I can just look at it and say, okay, this looks like allergy. This looks like, food sensitivity. This is probably due to low acid and they're stressed. So a lot of those things are going to be indicative by that. And then as far as like testing, I do some food allergy sensitivity testing. So I'm looking at a full, inflammatory and immune response to food. Because remember, we don't want our immune system reacting to food. We want our immune system reacting to the things that could kill us, right? So the bacteria and the viruses. So we'll look at IgE, which is a true food allergy, right? And then most people don't have a lot of those. And if they do, they know it because it's going to cause.
But that's the test that most doctors are checking, if they check anything at all.
Right. And so that'll come back and it'll be fine and say, oh, you don't have any food allergies. But yet you're making a ton of antibodies to, we see a lot with eggs, right? Every patient's like coming back with eggs. And we also can look at their reaction if they're making antibodies to their candida. So we look at that. We look at their complement factor, which tells us a little bit about how their innate immune system, their first line of defense, is working, and is it busy with food? Because if it is, again, what happens when we really do need our immune system to be reacting to the things that could kill us? So we do look at that. I don't do a lot of stool testing for, like parasites, because I feel like most of us have it. So I'm just going to go ahead and address it. And it's easy to do. It's not expensive, whereas the stool testing can be expensive. But if there's really a question, or if after we do a few months of an anti-parasitic kind of natural, obviously go in a natural route, then we will do some of that testing. I mean, it's information for sure. Checking for zonulin, which is the protein that will occur with the breakdown of those junctions. So that can be truly indicative of leaky gut, but not in the stool. So we really, when we do zonulin, we want to look at it through a blood test. I know they are doing some through the stool, but that's really not shown to be clinically accurate. So.
And do you do a lot or check a lot of DAO?
So yeah, DAO, which is the enzyme that will break down histamine, for sure you want to look at that. You can actually supplement with DAO because a lot of people are deficient in that. And that could be due to the fact that their bacteria is not making it. Their body's just not making it. It could be genetically, they don't have enough of it, or they're overly producing histamine because of foods or sensitivities that they're reacting to it. And with the histamine, we need to break it down. We break it down with DAO. So we have to look at the ratio. So when you measure a DAO, you always want to look at histamine as well.
Is there a way to check for LPS or lipopolysaccharides?
Yeah. So lipopolysaccharides are molecules that are basically pooped out, if you will, from bad bugs. So that's part of, so you do want to measure that and see. And that is also a serum test. You can find that in stool as well. But I prefer to just do all at once, do it with the serum, because you can do a combination zonulin with the LPS and the histamine. So that way you can just do it all at once. Most patients don't really want to play with their poop and collect it, depending on how bad they're feeling. But, there is some benefits to some stool testing. I just tend to do as much as I can without doing stool testing.
Sure. I think a lot of times with the food, the IgE, the IgG, the complement panel, that alone, we've seen symptom relief with that alone, without needing to, go deeper and check how much bacteria, good and bad, is in the gut and in the stool. And then, that is a very detailed test, but it's a lot of work too.
Yeah. And I think taking a broad stroke is okay. We don't have to get down to like, okay, well, they're a little bit low in, lactobacillus, acidophilus, whatever number. And then you're going to say, okay, I'm going to give them that one. If you just give them a broad spectrum probiotic, it's going to have some of that in there. Mm-hmm. So did we really need to do that? And the tests get expensive. So.
Oh, yeah. And so let's hop into the treatment, talking about probiotics. Why don't you tell us about the 4-hour regimen or the 4-hour protocol?
Yeah. So the 4-hour program, basically what we're doing is we're removing the things that are causing the problem, right? So remember Sidney Baker, he said, well, if you're stepping on a nail, you could take as much ibuprofen as you want. Your foot's still going to hurt. So same thing with the gut. If you're having a food sensitivity to something and you continue to eat it, and we're trying to fix your leaky gut, no matter what kind of treatments we're doing, how are we going to do that? It's continually being hammered. So we remove the things that are a problem. So that's why we do the food allergy sensitivity. That will give us an idea of, the foods that are really causing this inflammatory response and leakiness in the gut. So we remove that. If candida is present, we're going to do some, either herbs or antifungals to remove the amount of candida, because that's, again, got to remove the things that are causing the problem, and that can cause inflammation.
And I think going on to that, like just because their food comes up and it might show they have candida, what are some foods that we also want to advise specifically on how to remove the candida?
So with candida, they love sugar. That's why candida makes you crave sugar, because it's craving it. It's not you craving it. It's your candida telling you, you know what, you need more sugar. So we really put them on a very low glycemic, low sugar diet. And then you would remove like any of the things that potentially have yeast in them. So fermented foods, we will limit for a little bit. We know they're healthy, but not for everybody. So we'll back those out for a little bit. And we just do and it can be a good 3 months that we'll have them on this low sugar candida cleanse type diet. And then there's certain herbs that are really effective at removing the candida as well. And then balancing the rest of the bacteria in the gut to take the place of that candida and basically compete with it.
And I think a lot of people don't realize how much high fructose corn syrup is in a lot of the foods or drinks that they're taking in, and that attracts the candida. It doesn't have to say sugar in the food ingredient. That right. is equivalent.
Yeah, any corn syrup is definitely sugar, and it's like you bring that up, that like I have some non-negotiables. So, other than the fact that everything can fit, there are non-negotiables that can't fit, and that would be high fructose corn syrup, artificial colors, artificial sweeteners, and trans fats. So you're not going to be healthy putting any of those things in your body.
And then if they come up positive for mold or aspergillus, you also have a way to remove that.
Yeah. So again, there's a lot of herbs that we can do that will help to remove or help the body process what the molds poop out, which is mycotoxins. So we'll do that, but we also have to make sure that they're not continually adding the mold back in. So, we take them off of leftovers. That's a big one, because that can grow. The leftovers can grow in the mold. If you're continually eating it, it doesn't matter if we're removing it. It's like trying to, pull water out of a ship that has a big hole in it. So, so we'll do that. With mold, a lot of times it is food, but sometimes it's environment, especially here in Florida. Like all of our houses are probably somewhat moldy. So I like to have the patient do an ERMI, Environmental Relative Moldiness Index check, just to kind of get a baseline to see like if there is an overgrowth and maybe they are getting this mold, not necessarily just from food, or maybe it's not from food at all. Maybe it's really their house, or, could be even like a car has mold in it.
And mold can be hidden. It doesn't mean you have to see it. So people are all the time, they're offended, possibly, and they're like, I clean all the time. I'm like, it's hidden.
Yeah, it's really not about cleaning. It's about the fact that our houses are so closed, right? So we don't air them out, because especially, we have the air conditioning on. It's, 100 degrees outside. Plus we have a lot of humidity. Mold loves moisture. So you could clean your house all you want. Probably better dehumidifying your house. But even then, most houses in Florida are going to have mold.
So if we remove the foods from the triggering foods and get rid of the mold and the candida, we have to replace the good bacteria possibly?
Yeah. So in addition to those, though, parasites is another one. We all have them. I don't eat raw fish. I used to, I loved it. But, just seeing in my practice, some of these patients coming in and what they were dealing with, a lot of the, pretty much all the fish has some parasites in it. So I would just do a parasite cleanse as well. That's going to be part of my 4-hour program because I want to remove the things. The parasites actually steal the nutrients. So, and they compete with the good bacteria for your food. So they can cause dysbiosis in and of itself. And then they can poop out some funky stuff that can have really weird effects on patients. So so the removal phase for sure, I'm going to include the parasites. Then we're going to replace. So the second R is replace. So we're replacing the things that the patient is no longer making on their own or not making enough of. So we had talked about when you're stressed and you're in fight or flight, your body is not making hydrochloric acid or gastric juices because it's not looking to rest and digest when it thinks you're running away from a lion. Mm-hmm. It's going to do the things that it needs to do to get blood flow to your legs so that you can run. So it doesn't make a lot of hydrochloric acid. And that's really where you'll start to see a lot of GI stuff begin. So sometimes patients will come in and I'll say, okay, so you're having all these symptoms. When did they start? Oh, it's been about 2 years. What happened 2 years ago? I got divorced. I'm like, imagine that. So, then they're going to have reflux because we talked about, the esophageal sphincter is not going to close with low acid, but other things can overgrow. Like H. pylori, that's another big one that we see a lot of that one. So we'd have to remove that if we see that. Mm-hmm. That's an easy test though. So we're going to give them the gastric juice that they're lacking. And, first we want to make sure that they don't have Barrett's esophagus and, any kind of erosion. But assuming they don't, we're going to give them some gastric juice replacement. When you're in sympathetic dominance or fight or flight, your pancreas is not very busy releasing pancreatic enzymes for digestion. It's doing other things so that you can run away from that perceived lion and threat. So we oftentimes will give, enzymes, pancreatic enzyme replacement. And just that alone, it's amazing how much we can help with bloating. Mm-hmm. So, replacing those are the two major things that we're going to replace in the 4-hour program. And sometimes within a day, I'll see a reduction in bloating just from giving the enzymes. So do a lot of that. And then as far as repairing, so we want to tighten that junction back up, right? We want to help that single cell lining to be healthier. And one of the best things for that is the amino acid glutamine. So we'll give some glutamine. Aloe is really good for that. We give a deglyceride licorice and some arabinogalactans. Colostrum, which is, mother's first milk, but we get colostrum, we can get it from cow milk, or really colostrum is the same through any species. So we could even have whale colostrum and it would be the same as far as having the benefit. And that can help to reset the immune system and it helps to tighten the junctions in the gut lining. So we'll give that to patients as well as part of the repair phase. Then we have the reinoculate, and that's where we start adding back in the probiotics. So I tend to do all 4 of these at once. Some practices will stagger it, but I want my patient feeling better as quickly as possible. So with the probiotics, you really want to give a probiotic that has a good dose of a number, which we measure probiotics in CFUs or colony forming units. And you want to have a probiotic that has at least 10 different strains because we have a lot of different strains in our body. So you don't really want to just give one. And I see a lot of the ones that are in the retail stores, they just do GG or, just do one type of a probiotic. And then you could get where the patient would have too much of that one probiotic and that competes with the other one. So I do like to have at least 10, 25 billion CFUs as a minimum. You take it daily. You can take it with or without food. And, when you take it with food, it tends to have things in it that feed the probiotics. So we call that prebiotics, as long as they're eating a whole foods modified Mediterranean meal plan as we, assign them. And then changing the probiotic so you're not staying on the same probiotic for years and years and years. Like every 3 months or so, you want to switch to a different probiotic.
So what I'm hearing is not all probiotics are equal.
They are definitely not equal.
Now I get another question. I might be going off track a little bit, but do probiotics have to be refrigerated?
So if you think about a probiotic, they live in our gut, which our temperature, if we're not sick, is about 98.6. They probably don't start to die off until you have a really good fever, right? Because we get a fever to kill bacteria. So about 101, 102, you're probably going to start killing off your bacteria. That's a lot of times when you have the flu, you get diarrhea because you've just created dysbiosis in yourself. So they do tend to refrigerate them because they are living organisms and they will die off over time. If you're going with the manufacturer who's actually testing and guaranteeing till the date of expiration, they're probably overfilled so that if you didn't refrigerate it, it would still have plenty of
Potency,
till the date of expiration. But you do want to look at when you're getting a probiotic to make sure, or any supplement really, you want it to say expiration date, not manufacture date. Because expiration date really tells you that they know at that date you're going to have the same potency as it says on the label.
What do you think about rotating probiotics?
Yeah, absolutely. So like I was saying, like maybe every 3 months you want to switch out and have a different probiotic. So because there's, and there's probiotic, I'm sure there's plenty we don't even know about yet because, we don't know everything. We're learning.
Yeah.
Nutrition is a very new field. When you think about it, we learn stuff every day. And sometimes there's things that we think, this is the way to go. And then studies come out, 5-6 years later and you're like, oh, wow. I mean, when I went to school, we were supposed to eat every 2.5 to 3 hours, right? Because, that's how they kept your energy level and that was good for weight loss. And now we know actually you really should do some intermittent fasting, which we can always talk about another day.
Exactly. We're big advocates.
Yeah.
Now, are fermented foods considered prebiotics?
Fermented foods are probiotics. So
Okay.
Prebiotics tend to be, so there's usually either like a fiber, which is something that feeds the good bacteria that many times humans can't digest on their own. They need the bacteria and that's what the bacteria does. So it feeds on that. There's also a bacteriophage, which targets as its food. It's actually we have a probiotic. Well, this is like a provirus and it eats bacteria, tends to eat the pathogenic bacteria, and then what it poops out feeds the good bacteria. So that's kind of a neat prebiotic. And I like that one, especially for patients who have a lot of gas, because it's much more able to tolerate that. It produces a lot less gas than giving them the fibers.
I know a lot of people are not getting the fiber they need, and so I usually recommend to start at a low dose and increase gradually. Otherwise, if they start big, they're going to just bloat and have gas. I know that's a side effect of that. But
Absolutely.
So, you touched on what a healthy diet is and everything. I want to back up a little bit. Tell us about, say somebody came up for histamines. So you mentioned briefly, there's certain foods that we might think are healthy for us, but if you have a high histamine, that could be causing fatigue, and mast cell release. But there's certain foods that you definitely need to avoid, right?
Yeah, absolutely. And we have a full, most foods have some histamine or histamine releasing potential. So we do a low histamine. You can't do no histamine. You could drive your patient insane for sure if you're saying, okay, we can't eat anything with histamine in it. So we kind of say, okay, well, these things are high in histamine. So just let's stay off of those for a bit. We'll give you some DAO enzyme to help with any histamine that you have. It's kind of like resetting the computer when it starts glitching. We're going to just kind of shut that off for a minute and then we're going to turn it back on and you'll be able to better tolerate it.
Is this a good diet you think that would be good for somebody who has seasonal allergies or like chronic allergies or asthma even? Have you ever experimented with that?
Yeah, absolutely. Any histamine release, which it doesn't matter if it's food that's causing it or a tree or a cat or a dog or anything, whatever is causing the histamine to be released is going to benefit from not adding additional histamine to the body. It's like, you have that load of histamine. let's reduce it. So that's part of like the remove phase. We're going to reduce it as much as we possibly can. And then we're going to replace what you're not making, which is the enzyme, the DAO, so that you can better tolerate it. And then let's figure out the why. Is your immune system very busy fighting with your food? And that's why you're now releasing histamine to all these other things. It's not, it's being improperly messaged because of your environment. So that's what we need to really find out. We always look for the root, like why.
Yep.
We you have that symptom and that's interesting and you can put a Band-Aid on it, but why don't we fix what's causing it instead of just bandaging it up?
Have you seen a link with gut dysbiosis and mold toxicity and heavy metals?
Absolutely, because if you think about it, the heavy metals tend to be a larger molecule. If you didn't have dysbiosis and you didn't have an increase in gut permeability, that would be pooped out.
Very interesting. Thank you.
Yeah.
And I think as we've discussed, a lot of this, leaky gut, it's inflammation, right? And this can lead to aging, when we call that term inflammaging even.
Right.
And so autoimmune conditions, we talked about complements and how your body fights these particles and proteins as foreign bodies. And so have you seen people with autoimmune conditions such as Hashimoto's thyroiditis or rheumatoid arthritis? Have they been able to improve their symptoms and quality of life naturally?
Absolutely. We can, that's something I see a lot. So I do a lot with autoimmune patients. They tend to end up at my door eventually because I just feel like traditional medicine doesn't really have the answer for them. You wouldn't have an autoimmune disease without a leaky gut. So what happens is, again, those proteins that are coming through that we're eating, they're food. And we look a lot like food. In fact, at some point, we probably will be food, right? So your body can get confused. So it's going to make an antibody to, let's say you have IgG antibodies to beef or pork. Let's say pork because that's actually looks the closest to us. So now that antibody is every time you're going to eat pork, it's going to start to try and attack it. Well, it might be off by 1 or 2 amino acids and it looks a lot like our thyroid gland. So now it's attacking your thyroid gland and that's autoimmune disease. And it's, it could be, that's where they all are. It could be any of it. Could be Sjogren's, could be lupus, could be rheumatoid arthritis. So if we can fix that gut, and we can do some things to reduce the inflammatory damage and the inflammation response that you're getting every single day. Just calm things down. Again, kind of hit that reset button. You're going to see a decrease in symptoms to where they could go full remission.
What's the number one bacteria you usually see with bacterial overgrowth that causes disruption? So
I think it's going to be either the H. pylori or, the things you hear about like C. difficile. So, C. difficile is a really rough one. And that's going to be the one you'll hear about the most, because it causes the most problems.
And along the same lines, what's the bacteria that we're lacking the most?
It's really hard to say if there's one that we're lacking. All of the probiotics, the Lactobacillus acidophilus and the B. bifidus, it really just depends on every patient, So I think if you just, in this case, you can go broad stroke and just throw a wide diversity at a high dose in. Some will stick to the gut lining. What doesn't stick will pass through.
Yeah. And I like how you explained, or your recommendation of 10 strains, and you said 25 billion
CFUs. Make sure, a lot of the companies will measure it in milligrams, which isn't really the right way to measure a probiotic. You want to know how many colony forming units you're getting. And then 10 strains at a minimum, because again, there's hundreds of strains. You don't want to overdo any one strain.
So, I'm curious. I have people who like to do those colon cleanses. What's your opinion of that?
If you're not pooping, you got to poop. So I don't think it's a good idea to do those all the time, but for some patients, it can be life-changing. When you have a constipation or not a full defecation, that's going to cause toxins to build up. And it's not just the toxins that we think about, like heavy metals and pesticides and things like that, but toxic estrogens that your body has already processed, and they're all bundled up and they're ready to be pooped out. And then you don't poop, there's enzymes that will start breaking things apart in the colon, and then it goes back to the system. So I think, I don't think it's something you should just do as a general rule, like I'm just going to go in weekly and get a kind of like a, high, hot, and hell of a lot colon cleanse, right? We're not doing that. What we want to do is really make it so that we fix what's going on that's causing you to need that. And then you are pooping every day, because you should be pooping every day.
It is a waste product for a reason.
That's right.
All right. And so what is your opinion then of coffee enemas?
So actually, I'm kind of for them. I think that there's been some benefits shown. There's actually some studies that have been shown. It does get through the portal vein, and it can help clear out some things that are going on as far as toxins in the liver. And the caffeine is actually really helpful. It can cause the dilation and help you to poop. So yeah, I mean, it's use organic coffee, use filtered water. Room temperature, make sure you cool it down. So, but I've seen it help people amazing. Yeah. So again, but not every day. And the point is that our bodies can do what they need to do if they have what they need to do it with. So that's what we figure out. What do you need in order to make this so that this is happening all by yourself? We don't need to force it.
So we talked about a lot of different testing and treatment. Do you think any of this is worth it if someone is not willing to make the changes?
If they'll just make a little bit of change. So you have that patient who comes in and they're like, well, I don't care what it says. I'm not giving this up. So the testing that I use, they actually have an immune index where they've weighted how badly is the food actually causing inflammation and immune dysfunction. So sometimes I'll say, all right, yeah, you should really be off of these, 12 foods, but you're saying you won't give up, you just give up the top 5. So let's look at the top 5 most offensive foods. Well, you do that. Most patients will say, yeah, okay, I'll do that. I take everybody off of gluten. So if they won't do the top 5, I say, all right, just get off of gluten, and drink water, right? Instead of drinking your coffee all day long, let's get half your body weight in ounces of water and just stay off gluten and do it for a week. Because honestly, they'll feel better within a week. That gut lining, that one cell, it turns over every 6 to 7 days. We can do a lot with a patient in a week.
And we can verify that. We see this in our practice all the time. People who just follow that basic rule do feel better for the most part.
Right.
Well, I think this was very informative. Thank you so much, Elyse.
My pleasure.
And why don't you tell our listeners how they can find you?
Okay. Well, you can reach me on my website, which is the nutritioninstitute.org. And I am on Facebook at the Lifestyle Nutrition Institute. And you can always contact me by phone, 561-252-7857.
Thank you so much.
Thank you.
My pleasure. Thanks for having me.
The information contained in this podcast is provided for informational and educational purposes only and is not intended for the purposes of diagnosing, curing, treating, or preventing any disease. This podcast is provided on the understanding that it does not constitute medical or other professional advice or services. Before using any products or services referenced on this podcast, consult with your healthcare provider, carefully read all labels, and heed all directions and cautions that accompany the products. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Dr. Brian Marias, Deanna Weilbacher, and Hybrid Medical Solution, do not claim responsibility for any adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for any statements made by the guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referenced.
If you would like to submit any questions or if you have any topics you would be interested in hearing about on future episodes, please contact us through our website, www.hybridmedicalsolution.com. That is solution with no S at the end. Follow us on Instagram and Facebook, all under Hybrid Medical Solution.